I'm Dr. Hilary Coulombe here at Glen Oak Dog and Cat Hospital, and today we're going to talk about spaying and neutering. My assistant Evelyn's going to ask us some questions.
Hi, Dr. Coulombe. What is cat neutering?
So cat neutering is where we remove the testicles, and cat spaying is where we remove the uterus and the ovaries. Technically, you can use the terms interchangeably, but that's just what they typically mean.
How does spaying or neutering impact the health and well-being of your cat?
So it's gonna, one, prevent unwanted behaviors. So for males, sometimes they can spray or mark, which obviously no one wants in their house. Male cat's pee has quite a distinct odor that you typically don't wanna live with. And male cats can also wanna get outside to search for those females. Female cats, similar thing, they can have marking behaviors, they can wanna get outside to look for those male cats, so prevents runaways and really helps the overall health of your cat.
Okay, how soon should I bring my cat in to see the veterinarian to get them spayed or neutered?
So we typically recommend spaying or neutering around 6 months. Now, that's not the first time that we should see them. We should be seeing them when they're about 8 weeks old, so we can start their kitten vaccines, we can start talking about spaying and neutering, but that's when we'll actually do the procedure.
What are the medical benefits of spaying and neutering cats?
So we can prevent testicular cancer if they don't have testicles. We can also prevent a uterine infection called a pyometra. And a pyometra is essentially where the uterus fills up with pus and it makes the cat very sick. It's an emergency surgery. It's something they can die from. So if you're not planning on breeding the cat, definitely recommend getting them spayed and neutered.
Okay, will doing that, the spaying or neutering, affect their behavior?
So it's not going to affect their personality. You can find a lot of stuff online saying that that's just not true. Now it is going to affect their behavior in the positive. They're not going to be marking, they're not going to have humping behaviors, they're not going to be, spraying, that sort of thing. So those are all things that we didn't want to happen anyway.
Okay, and if my cat is in heat, how long am I supposed to wait before I can get her spayed?
So cats are a little tricky because they don't have a defined heat cycle like a dog would where it's 10 days and done. They kind of go in and out of this heat. So we'll try to find a time where it seems like they're not in heat, but we certainly can spay them while they are in heat.
Okay. What are some possible conditions that can be helped or prevented by spaying or neutering your cat?
So kind of like we already talked about, so that pyometra, the uterine infection, and then also just mostly them trying to escape and get out and find other cats.
How should I care for my cat before and after spaying or neutering surgery?
So we're going to tell you how to prepare them before. We'll typically want you to fast them prior to the procedure, so that means no food, just like if you or I were to go in and have a procedure. Afterwards, we'll have them wear a cone for about 10 to 14 days, just to make sure that they're not licking at their incision. We'll also want to try to limit their activity, which can be really tough in cats. So some things you might want to do is have like a separate bedroom for them to hang out in, just so they're not running around like crazy all over the house. We're going to provide you with good pain medication, so they're going to be feeling great. We just want to give them time to rest after their surgery.
Great, thank you.
If you have any other questions or want to get those appointments scheduled, please give us a call.